Every man believes he knows his partner's body, yet studies show a vast, unspoken disconnect in intimacy after 40. Are you missing the crucial areas she secretly longs for you to explore? It's not about technique or stamina, it's about precision, understanding the invisible map of female arousal that most men completely overlook. Many men confuse pressure with pleasure, leading to frustration and fading intimacy. I'm here to tell you where to focus, why it works, and how this simple anatomical knowledge can instantly revitalize your confidence and your relationship. Prepare to shift your focus from frantic searching to deliberate, powerful connection by mastering the 3 key spots every woman truly wants you to touch. The 3 forgotten pleasure centers. I am Dr. Vera Sterling, and for years, my work as a urologist and specialist in sexual health has centered on correcting the immense misunderstandings that sabotage intimacy. Today, we address a common, yet often unacknowledged, problem: the decline of satisfying connection driven by a lack of anatomical understanding. For men over 40, the pursuit of intimacy often becomes driven by performance, neglecting the core truth that female pleasure is rooted in nuanced, highly specific nerve centers. I will guide you through the 3 places every woman secretly wants you to touch. These are not grand gestures or complex maneuvers. They are precise, anatomically vital areas that unlock genuine arousal and deep connection. The first place we must understand is often completely ignored during foreplay: the inner thigh and perineal bridge. The inner thigh, near the groin, is rich with sensory nerves, acting as a crucial preliminary zone. However, the true secret lies in the perineal bridge, the small stretch of skin between the vaginal opening and the anus. Anatomically, this area serves as a junction point where multiple pelvic nerve endings converge. It is not an area for pressure, but for featherlight, exploratory touch. Why is this area so powerful? It's about the pudendal nerve. This is the main nerve that carries sensation from the external genitalia to the brain. By stimulating the perineal bridge gently, the signals are broad and highly sensitizing, priming the entire pelvic region without overstimulating the most sensitive zones immediately. Most men dive straight to the clitoris, causing rapid desensitization and often, discomfort. The perineal bridge is the delicate prelude that builds anticipation and relaxes the pelvic floor. A touch here should be slow, almost hesitant, using the pads of the fingers or a soft tissue, to awaken the nerve endings without creating friction. It's an act of respect for the body's delicate wiring. Mastery here signals patience and knowledge, 2 qualities a partner values immensely. The second critical area is about moving away from the visible, towards the deeply hidden, the urethral sponge. The urethra, the tube through which urine passes, is surrounded by a bundle of highly sensitive tissue known as the urethral sponge, or the area often referred to as the G-spot by the public. For decades, this area has been misunderstood and mythologized. As a urologist, I can explain its true significance. It is not an arbitrary spot, it is a concentration of the deepest nerves of the clitoral network. It is located on the anterior, or front, wall of the vagina, just a few inches inside. The urethral sponge is unique because it responds best to internal pressure, not external friction. The technique here requires curved pressure, directing the finger slightly upward towards the belly button. This pressure triggers a deep, visceral feeling of fullness and excitement. The common mistake men make is using a straight-in, forceful motion, which is uncomfortable and ineffective. This area requires the woman to be already warmed and relaxed, as its stimulation is intensely powerful. Focusing on this area shows an understanding that pleasure is not just external, but complex and multi-layered. When this area is touched correctly, the resulting pleasure is often deeper, spreading throughout the entire pelvis. It is the key to activating the body's expansive, internal response system. The difference between merely finding these spots and mastering them is the difference between a fleeting moment and a sustained, profound connection. It is the difference between performing a routine and engaging in a truly intimate dialogue. But these 2 areas, while vital, are incomplete without the third, and perhaps most overlooked, zone, a zone that ties the entire nervous system together. We must now turn our attention to the connection between the pelvis and the nervous system, a surprising region that transforms intimacy from a purely physical act into an emotional and physiological release. This final, most critical area is the key to sustained, overwhelming pleasure, and it is almost always forgotten. The neuroemotional anchor and sustained pleasure. Welcome back. I am Dr. Vera Sterling. In the first part, we explored the preliminary sensations of the perineal bridge and the deep visceral response of the urethral sponge. Now, we complete the map by revealing the third and arguably most powerful area that unlocks profound female pleasure, the root of the spine and sacral nerves. This area is not a sexual organ in the traditional sense, but a neuroemotional anchor that governs the body's deepest response to touch. The sacral region, located at the base of the spine, is where the main parasympathetic nerves, the rest and digest system, originate. These nerves are responsible for involuntary arousal responses, blood flow to the genitals, and, crucially, the ability to let go of tension and experience pleasure fully. When a woman is stressed or anxious, her sympathetic, or fight or flight, nervous system is dominant, shutting down the channels for deep pleasure. Touching the sacrum, the lower back just above the tailbone, with warm, consistent pressure, sends a profound signal of safety and trust directly to the central nervous system. The technique is simple. Use the flat of your hand to apply gentle, warming pressure or a slow, circular massage. This simple act redirects the body from tension to relaxation, from anxiety to acceptance. By calming the parasympathetic nervous system through the sacrum, you are effectively opening the gateway for the pleasure signals from the perineum and the urethral sponge to be fully processed and experienced by the brain. This is where intimacy transcends the physical act. The common failure in intimacy is attempting to force pleasure without first establishing physiological safety. You can stimulate the clitoris perfectly, but if her nervous system is locked down, the experience will be limited, superficial, or even painful. By anchoring her at the sacrum, you achieve two things: increased blood flow to the entire pelvic region, enhancing physical sensation, and a profound emotional release that deepens the entire experience. It is the ultimate expression of care and knowledge. The successful application of these three areas, the light sensory awakening of the perineal bridge, the internal deep pressure of the urethral sponge, and the neurological release via the sacral nerves, forms a comprehensive, anatomical roadmap to lasting satisfaction. To integrate this knowledge, men must reframe their mindset. Stop viewing intimacy as a performance to be executed, and start viewing it as an exploratory, listening art. The rhythm of successful intimacy is not speed, but patience. Start with light, external, broad strokes, or the perineum, transition to internal, focused pressure, or the urethral sponge, and anchor the entire experience with safety and relaxation, or the sacrum. The most powerful tool a man possesses is not his strength, but his deliberate intention and knowledge. This approach moves intimacy away from the simple pursuit of orgasm and toward the creation of a powerful, lasting emotional bond rooted in mutual understanding. When a man knows these centers, he communicates respect, care, and a deep, scientific understanding of his partner's body, qualities that are infinitely more attractive than any attempt at brute force or frantic searching. The true secret to her pleasure is not in what you find, but in how intentionally you search.